The view observed in this remote location of Haiti, located a half-hour drive from the town of Jacmel, is breathtaking. The mountains follow one another like dunes, and their proximity to the seashores allow the local residents to have rapid access to other markets to sell their goods. The sound of the waves hitting the sand and rock on the shoreline bring peace and serenity to anyone who takes the time to appreciate this natural feast, but also reminds us that the sea remains a primary source of nourishment of this locality called Pétavie. This rustic beauty is only matched by the inner beauty of each individual member of this medical mission, comprised of doctors, nurse practitioners, nurses, nursing students, volunteers, along with the many core organization members falling under the HAPC umbrella who are willing participants in the second medical mission in the region. The mission targets school children, primarily from the school École La Dignité de Pétavie, for one full day, and extends its coverage to the adults the day after. The Filippo family members of this coalition, in memory of their son Robert, who passed away last year, hosted this year's mission. Since this earthquake, Haiti's plight has been in the limelight and has attracted scores of NGOs and other relief agencies to the country. However, other groups and institutions were quietly operating in the country for many years before, helping to better the lives of the impoverished nation. The Haitian American Nurses Association, HANA, is such a group. For many years, this entity has provided healthcare to thousands of Haitians, both in the Republic and in the Batays next door, through dozens of such missions, covering different areas in the country. HANA is the lead agency from the Haitian American Professional Coalition conducting this mission.
As the chairperson of the Haitian American Professionals Coalition, my role is to make sure that each core association's activities or initiatives are supported, and by making sure the board members are involved in the process. And it is important for HAPC to help mobilize and empower each core association in making sure that projects are successful.
Emanuela Jean-Baptiste, the nurse who was appointed by the coalition to coordinate the project, worked for months on all aspects of the mission. She made sure the proper medicine was ordered, presided over countless meetings with the different members of the coalition, and made sure the adequate personnel was present to ensure the success of this medical relief mission. She reflects on this year's experience.
To put a mission together, it takes a lot of manpower. You have to have a location. You have to know exactly how many people you can see for that day or for that weekend, for that week. And you have to have nurses and doctors that are willing to go with you on that medical missions. The association have been to medical mission in Dominican Republic and Haiti, and for the last 7 years. So we actually have an idea what we need. My role was to make sure that we get all the medicine, get all the nurses, the doctors that were supposed to work for that weekend to go to Haiti. And I was able to contact all the nurses, all the doctors, and Dr. Jodiste and I were able to get the medicine to the different buyers that we bought from Miami to get those medicine. And getting the luggages, where we had to add like 45 to 55 luggages, we had to make sure those luggage get to Haiti.
Tamara Filippo presented the project in 2009 to the coalition.
After doing other missions with different organizations, more specifically a mission I did with Ed Lozama and Lekai, I decided to approach the school of l'École de la Dignité, whom I met Mrs. Vieux, who is the director of that school, to do more for the kids that she served over there. So I approached HAPC, the Haitian American Professionals Coalition, to put this mission together in collaboration with CAVCP, which is Caribbean American Visual Culture Preservation, and also the Haitian American Nursing Association, HANA. And that's how this idea came about. Overall, the mission was a success. Unfortunately, we had a personal tragedy in our own lives, my husband and I. We lost our son, my stepson, of course, Robert Filippo, and my husband was not able to to participate during that mission. And this mission, the second year, the board of the Haitian American Professionals Coalition voted unanimously to do the mission over the second year, and we got a lot accomplished, and Jean-Aubert Filippo was able to take part in the mission, and we intend, hopefully, with the help of HAPC, CAVCP, and also HANA, to continue with the mission.
This mission to École La Dignité de Pétavie has become a yearly event for many reasons, but one needs to refer to the dedication and love for the children of the area of Viviane Vieux, its founder, to understand.
I would like to start by saying that the school is completely free of charge. The kids do not pay for books, they do not pay for tuition. I enrolled the poorest children in the school. Many of these students also have jobs. They have to tie animals, go get water, and perform other chores. Many of them are what is commonly called reste avec. They may live with their relatives, uncles, aunts, cousins, but they have to wake up by 5 a.m. daily to get wood for cooking so that the other kids in the house can go to the school. I have also discovered that many of them are kind of slow in learning. They are not severely retarded, but have various levels of learning disabilities. My theory on this situation is that this problem results from chronic lack of proper nourishment during pregnancy, which resulted in some improper development of their brains. I call them my special kids. The only satisfaction I get at helping to nurture them is that at least these kids do not sit around all day doing nothing. Watching other kids going to school, they actually attend school as well.
The area where Mrs. Vieux chose to call home has a culture and life of its own. This coastal town converges twice a week to the port of Marigot, where waves of boats, coming mostly from Pointe-à-Pitre in the southern eastern region of the country, discharge their load of fish, conch, bales of used clothing, commonly named pepe, charcoal and other goods from the Dominican Republic indispensable to the daily subsistence of this region and beyond. The activity in the marché of Child-HAPC is just as frantic. Scores of merchants and customers spend their time arguing for the best deal to exchange merchandise, which forms a sonic cacophony only interrupted by the loudspeakers of some vehicle advertising the ultimate painkiller or healthcare product.
C'est pour ma d'avocat à plus d'avocats qui fait chez vous pousser, qui fait chez vous profiter. Donc, plus passer dans la machine, réclamer un pour ma d'avocat à plus d'avocats et on va trouver une solution.
All day, these exchanges take place until some merchants have exhausted their goods or the last customer is gone. Then, they will pack up their portable display stands and hire a motorcycle to take them home or ride their mules up the mountain to feed their families, having made some money for the day. They live under the same principles of trade and exchange, that has existed since the beginning of mankind. Very early in the day, the staff woke up to a good breakfast at their local hotel in the mountain. A wide range of knowledge and professionalism was united in their desire to use their skills for the good of others. Their qualifications and commitment would be the envy of any medical establishment in the States.
I have 15 years of intensive care and emergency room experience. And after that, 3 years of additional training specializing in the management of adult patients, and more specifically those with diabetes. Well, it's been an interest to me for many years through friends that are in the coalition and in the Haitian American Nurses Association. And after the earthquake, I know many people were very interested in volunteering, and this weekend mission was just absolutely the right time and the right opportunity for me to come down and experience and give back and share my professional skills.
I am a new ARNP. I work as a neuro step-down nurse at North Broward. What inspired me, my love is for my country. I went to nursing school so I can help. I can come back to Haiti and do some medical mission. I went to ARNP school because I wanted to do more. I wanted to be able to prescribe and assessment to get better at my assessment skill. What inspired me, I've always wanted to give back to my country. That's what inspired me to come back and help.
This isn't my first mission. I've been to Haiti before on a mission. I love Haiti. My family's from here. I was sponsored by CAVCP, and I came along with the ladies of HANA via CAVCP. And basically, it's just my passion to help the less fortunate, and especially my own people. So this really feels like my obligation. It doesn't feel like I'm doing anybody a favor. This is part of my life, basically.
I'm a registered nurse. I work at University of Miami Hospital, and what brought me here was my dad is Haitian, my mom is American, and I always wanted to, come to the country. And this was the opportunity to come to the country, help children in need, and especially after the earthquake. It was a passion of mine to come and to help out where the need was.
Well, actually, this mission is not really my first mission. This is my third mission. It's rewarding. As a nurse, you do want to come back. You do want to give back to your community. That's the best way I know how to be a great nurse.
Okay, I've been a nurse almost 7 years. I'm a registered nurse, and I become part of HANA. Mrs. Marie Etienne was a former teacher of mine that kind of elaborated on HANA, the Haitian American Nursing Association, on what they do, and I was interested and I joined HANA. Well, this is not my first medical mission with HANA. I've been previously to Haiti after the earthquake on more than one occasion with HANA.
I'm an advanced trained nurse practitioner. I have a master's in nursing, and I'm a psychiatric trained nurse practitioner. And that's my credentials. I am a professor at Miami-Dade College, and I also worked for Florida International University for at least, I think it was 13 years before I moved over to Miami-Dade College. What inspired me and what actually prompted me to do this mission was Professor Marie Etienne. Professor Etienne usually takes a group of students from Miami-Dade College to migrant camp in Dominican Republic. And she mentioned to me that she was going over the Labor Day weekend to Haiti, to a city called Jacmel, and they were going to be doing medical screenings for children at a school. So I told her I was on board.
As a ANA member, new ANA member, and a nursing student, I heard about the mission that was gonna go to Haiti. So I volunteer myself because, you know, I'd like to know what's going on, because when I heard the news about Haiti, I didn't know until I went there and I see what's going on in Haiti. That's really touched me a lot. Because some people think like once they're helping somebody, they need to get something back in return. How I think about it, if you volunteer, that's like you're helping somebody, you're saving lives. That's gonna, even tomorrow, when you think about it, you're gonna feel good about yourself. At least you help someone. You know, you make somebody feel good.
Well, first I was informed by my mom that there was going to be a mission to Haiti, and I've always actually wanted to go on one. And I was told that I can get volunteer hours for school and I'd be helping out people. I'd be doing like vital signs or working in triage. So it was a great opportunity for me because I wanted to go into the nursing field, so I took it.
I wanted to participate in the medical mission in Pétavie, Jacmel, this year with HAPC because of all the great work that I heard they did last year. And another reason I wanted to do something with the organization is because of the moment that it occurred. It was during the anniversary of my late brother's death, and I thought it'd be a great honor in his memory to help those that in need in Haiti, with those at the school and the students and the parents and teachers.
The medical team then converged at the meeting place to assess the merchandise and supply and packed up the necessary ones for the first day. Then the suitcases made their way up the mountain where the school is located, carried by local volunteers, followed by the medical team. The journey up the mountain passes through many cracks, trails, and takes an average person about 20 minutes to reach the top, where a breathtaking view of the sea greets one. In a valley half through this mountain, rising like a beacon of hope in the middle of this natural environment, lays the school École La Dignité, whose name alone signifies the purpose of the establishment as described by Mrs. Vieux.
My goal for every child who attends L'École La Dignité is to infuse in them the notion of dignity, a dignity about themselves, a sense of pride of themselves, a sense of who they are and what they are worth. In the early days, there was no cafeteria in the school. The small meal we gave to the kids was eaten from the floor. Today, we eat properly at the table in the morning.
Then there they were, scores of children, babies as young as 9 days old, carried by mothers, fathers, and even neighbors, were patiently and orderly waiting for the gift of benevolent health care, which should have been a right for them. The children, many of whom attended the school, answered the invitation and wore their Sunday clothes and expressed their innocence through their eyes. The screening process was divided into 5 sections, as the team leader and nurse practitioner, Marie Etienne, explains.
We've created a plan a plan, whereas where we set up for triage, where we set up how many nurses we would need in each area, how many doctors we would need to provide the physicals, and also the clinical pharmacy, who would be there to actually prepare the medication and also provide patient education. First, we have all the patients lined up. They receive a number, and as they arrive in the triage, we've collect their demographics data, like gender, date of birth, and we do the vital signs. And then from there, they go to the nurse, where the nurse would actually do a physical, and the nurse determines the priority of care. And finally, we take them to the next step to see either a nurse practitioner or the physicians to be examined. After the examination is done, we go to the pharmacy, where they hand in over their prescription that was given by the nurse practitioner or the physician. Then the patient receives the medication, and after that, there's another step where they get patient education on how to take the medicine, what are some of the signs and symptoms to look for. And after they've received their education, then they go to the last station, where they actually receive a bag of supplies, back to school supplies, foods, and hygienic products. As they exit, they give their form to the person who's actually documenting using electronic health records. Because last year we had someone who volunteered to document all of the patient's information and electronically, so we can know who we saw the previous year and to better prepare.
The number of patients grew as the day progressed. Nurse practitioner and specialists in psychiatry, Heather Holder, designed a plan to ease the kids' patients by entertaining them with fun activities such as face painting and rewarding them with toys and sweets.
The children were waiting in line, and people were here in lines for like 2-3 hours. So my goal was to engage the children while they were waiting to see my colleagues, and to take some of the stress off of them, because as children we don't think about them being stressed, but I provided that de-stressor for the children. They were able to come and I engaged them in some art projects. They were painting. I did the face painting the best I can. I'm not an artist, so all I was able to do is maybe a smiley face and a flower. But the children, and I also spoke to the children about me being a nurse, and they were like really taken back that a nurse could be involved in such fun things. To me, that the children were more taken up with my outfit as a clown, and seeing the things that I did for them. It took the stress off of them waiting to see the doctor.
At triage, the room was divided into 3 sections to better facilitate the flow of traffic. We are gathering the essential medical information to move the patients to the next phase based upon their immediate medical condition needs. Each individual member of this team was focused and provided their best to the deserved patients, many of whom had never seen a healthcare professional for years, and on occasion, never. Dr. Dufresne, the mission's lead doctor, played a dual role. He evaluated the hundreds of patients referred to his care for accuracy of symptoms before prescribing the required drugs to heal them, while teaching and explaining his diagnostic to the assisting nurses, just like in a hospital environment. He reflects on his participation in the mission and compares it to the previous year's experience.
I've been such a long time. We always participate in the mission of different missions, such as in the Dominican Republic. Now with the earthquake in Haiti, now we go to a different mission in Haiti. So recently, for the Labor Day, we've been in Pétavie, where we participate in a mission. It was a good opportunity with that we had so that we can examine them, examine the adult and so the children, so we can provide them the medical necessity that they need. We had the opportunity to treat a lot of people. We have different medical problems such as high blood pressure, diabetes. We have a lot of children that are necessity with a skin disease, with dehydration. But first of all, it's something that comes from the heart, something that I like to do, And also, since I am part of the HAPC, I'm the vice representative of the health care in HAPC. So after Dr. Jodisti, it's me. So anytime they have a necessity, I'll be there. I'm there. So therefore, and I also have the opportunity to orientate, to help the nurses, to share, the ideas, to share, the knowledge that we have, that we acquire with the long experience that we have.
Working close with the doctor, Dr. Dufresne, he was great. Seeing the patients, looking at their diagnosis, assessing them, that was also a great experience. And, getting them the treatment that they needed right away, seeing patients after patients. I mean, the time went by. We didn't even realize what time it was. I mean, it was just a great experience.
During both days, the adults present received a much-needed lecture to educate them about the AIDS virus, how to protect themselves, and urged to spread the message to others.
Parler sur maladie que nous connaissons qui ravagé tout le monde, tout côté. Qui maladie nous t'a supposé là? Sida. Que nous allons parler de virus qui bat sida, microbe là, qui bat maladie sida, parce que le que faut un virus avant pour gagner maladie sida, pas vrai? Nous toutes là besoin d'éducation. Ma bonne nous pral bay petit nous pral bay petit nous, OK? Nous pral bay tout le monde. Faites un coup c'est l'évangile là nous pral prêcher dans la rue.
My actual position is to serve as a triage nurse, so the first encounter the patient has is with me. We do a basic assessment head to toe. We take basic information like height, weight, and age, chief complaint, and from there we make a decision if that patient needs to actually see a physician or if that patient can be cleared by a nurse practitioner and go home on some prescription medications.
Day one, we saw the children. The problem I see with the children is malnutrition. The malnourished, the anemia, constipations because of the diet. That's what we focus on.
What we do also, while we're giving the medication, so we have to treat them also to help them to the knowledge, to know how to take the medication.
The final phase of the cycle was the pharmacy. There, medicine and vitamins were carefully counted and separated under the strict supervision of nurse practitioner and clinical pharmacist Suzanne Danis.
I honestly didn't think that I would be serving in that role, and that's what's really nice about volunteering is if you come in with an open spirit, you don't know what you're going to be doing. The last day, for a good portion of the day, I treated the adults. The first day and a portion of the morning of the second day, I had the opportunity to serve as essentially the clinical pharmacist because we had no one volunteer to come down from a pharmacy background. But you're exactly right. As the last line behind a series of several nurses checking to make sure it's the right dose, it's a tremendous responsibility. There are no computer systems here. There are no cross-checks. There are no pre-printed instructions. It's not like walking into your typical corner drugstore and coming out with a bag. Whatever instructions they get and guidance, it comes from one person or a group of people together making the right decisions, and it's extremely important.
The pharmacy seemed to be the busiest stage in the cycle. The patients were matched with their prescriptions by being called by name. Then a nurse or member of the volunteer staff carefully explained the prescription to them, insisting on the how to use method. The adults accompanying the children were asked to repeat the information prior to be sent home. A minimum of 3 months' supply of vitamin was given to every patient in addition to their medically required drugs. A specific chart was made of each patient for further evaluation and assessment in the future. This was an important phase, and those who participated in dispensing medicine took pride in the job.
The experience was very, very interesting because we were working at a fast pace because we saw so many patients in one day, and being able to determine which medication for what, and also to make sure that they get instructions and being able to explain the instructions to them was very interesting.
Doctors and nurses are supposed to be immune to the pain and condition of their patients. But the overwhelming situation in Haiti brought nursing student Esther to tears as she attended to an old lady who walked for hours to reach the facility for treatment.
Well, when I saw the old lady, I can tell that she was hungry. And I just once I saw her face and the way she was looking, I just think in myself, that's like my own grandmother that need help. And she was about the same age as my grandmother that's still alive in here. So that's why I tried to help her out. It's like I was helping my own grandmother. That's what I felt when I was helping her out. Because I can tell she was hungry, and I gave her some money because I want her to be happy that day, even if she's not gonna be happy for the whole life or whatever. But I just want her to be happy for that day so she can go home and eat something and just live her life. You know, that's how I felt. And I was happy about it because I was able to help her out.
Esther's personal sensitivity towards this elderly woman triggered my curiosity and prompted me to try to follow her home after a medical visit ended. Helped only by her omnipresent cane, the old lady climbed mountain after mountain at the same comfortable pace. At times, the terrain was abrupt. At other times, it seemed easier to navigate through. As she climbed home, she saluted acquaintances along the way as she held a bag full of medicine tightly as a precious gift. I started feeling my breathing going more rapidly and waited for her to slow down, but she kept going and going, further and higher.
Depuis matin, je suis bâti. Depuis matin? Depuis matin. Je dis que je ne pas supporter. Je ne supporte oui. Oui. Mais je connais apprécié aller. Vous n'avez pas un petit médicament? Oui, comme oui.
Soon, the sound of compa music filtered through the natural sounds of the mountain and grew closer. We had just dropped on a party about to start. And the old lady showed a few dancing moves as impressive as Beyoncé's. I quickly took a peek at the makeshift club, and upon returning outside, I saw her silhouette at the top of the mountain. She was gone. I accelerated my pace to reach her just as she got to some relative's house, miles away from hers. I finally gave up on trying to accompany her home and sat down to talk to her.
McLaren, dis-moi, combien de récoltes café vous avez sous tête?
Combien de gains? Oh, je suis 4 là. 4 là-bas, oui. Je vais quitter tout ça.
Ok. Et 1927, les fêtes. McLaren, vous avez 83 ans. Je suis suivre là, monter mon là. Bon, moi-même, je suis un petit bouquet. Dis-moi, quand on a une force?
Eh bien, bon Dieu, bon monde. Jésus, bon monde. Mettre la femme dans bon Dieu, mettre confiance dans Jésus. La pousser monter.
Bon, moi, Claire, nous arrivons là, nous avons un voisin là, il dit, nous ne pouvons pas mettre en route toujours. Toute machine marche là.
Non.
C'est bourrique pour nous arriver.
Oui, pour monter. Et quand famille nous est là? Oui, moi, je suis famille, je suis
mais c'est pas là sorti matin?
Non, je suis dans tellement honnête.
Mes amis? Bon, combien de temps ça prend comme ça pour t'arriver à l'ouest docteur aujourd'hui?
Oh, on sale de boule de son aller mal. Ma petit bâton.
Où est-ce que tu bâton?
Oui, mal au caille, mal l'église au caille. Mal à ta mag mal, faut qu'à dao.
Bon, qui sont mangé bien?
Moi-même, qui ça mange? Moi, une banane, moi mange. Moi, un diri, moi mange. Moi, un maïs moulé, moi mange. Moi, un pois, moi mange. Ça, vient cochon balade.
Depuis que l'on a docteur?
Moi-même, quand docteur vient, moi, docteur, mais n'importe quel docteur vient quand on a quelqu'un, moi, il vient sous terrasse net, moi, il vient un modèle, moi. Qu'est-ce que c'est docteur qui est même là, médicament docteur?
Bon, médicaments yo et pour qui ça yo ba yo?
Pour tension, pour douleur. C'est même ça quoi pas bon du tout. Bah bon, on doit lever hier, ma pour un coup un cabane comme ça, on l'a tiré pour me tomber, me frapper tout en bas bouche, moi bouche m'enfler. Et pas comme ça bouche la tête.
Donc est-ce que vous expliquez bien qui j'en pour prendre médicaments yo?
Expliquez-moi. Mais c'est mon baillon tout bon non?
Et qui sont à remédier tout les gens qui mettent le programme ça sous tête pour être capable d'aider grand monde ni gentil monde dans la zone.
Oh, papa. Là nous sommes gloire, bon Dieu fait pour nous, sommes grâce, bon Dieu fait pour nous. Parce que nous sommes là, nous étions pas un médicament. Alors nous sommes comme ça, nous sommes docteur qui nous nos médicaments. Nous disons bon Dieu merci. Aussi des gens tout. Docteur tout nous disons merci.
The group worked really hard. My goal is my job, my task was to accommodate them all, to make them feel they were well received. I had a great meal prepared for them. I had a little get together after a long, hard day of work. I felt that it was important for them to relax and to get to know the people of the town.
This year, a new location was added out of necessity, due to the fact that many elderly had tremendous difficulties reaching the top of the mountain, a serious challenge even to healthy people. A makeshift triage position was staffed at sea level on the patio of a local resident who willingly offered a home to the benefit of the community. A few dozen people took that opportunity to see the health specialists who treated them and gave them medicine, vitamins, and supplies for the next 3 months. The medical professionals who sacrificed their holiday weekend to bring medical relief to the residents of this remote area of Haiti reflected on their most touching moments of the trip, the lives that they saved, and those who impacted them for a variety of reasons, symbolizing how similar we all are as human beings.
Everything was like a disaster, but I was very happy. I was one of the people that went to help them out. And I think we really saved some lives over there, and it's really helpful.
It pleases me. I mean, like in nursing in the medical field, there's so much you can do to help individuals. However, when you see the ones that don't have the opportunity to actually go to a hospital due to finance, insurance, etc., and they come to you and the joy you see in their eyes, they want the help. They're there through rain or shine. I mean, which other way could you feel? I mean, it brings joy to me, and I want to continue.
So there was a lady that came. It was around 9:30. Her blood pressure was like 240 over 110. The blood pressure was very high, and she was never taking any type of medication. Her blood sugar was over 200. So we proceed by giving her medication for her blood pressure. We treated her blood sugar, give her some med, and then we had somebody that was sitting with her on one-to-one to keep on monitoring her. We fed her. And I'm looking at that lady. She was so close, like she could have a stroke, and God knows what would happen that she didn't have the care. So I think that was really a life-saving time, you know, taking care of this lady. And you were so rewarded to be able to save somebody else's life.
From the first day, there's just one little girl. When she was in triage, filling out all of her paperwork, one of the nurses couldn't really communicate with her because she was deaf. And my senior year of high school, I did take sign language. So I went over there and I started to sign with her. Like I didn't know what to expect. Originally, I wasn't expecting a response, but then I asked her what her name was, and she just signed right back to me. And then I was so surprised. I just started talking to her, asked her her name, her age, if she wasn't feeling good, what was bothering her. I was asking her if she was hungry, everything. It made me feel so good inside that I was able to help someone out, and that I was able to use my sign language skills that I did learn in high school. I just haven't been able to get that out of my mind. It's like one of those things, like, it just feels great.
There's like 2 little girls that actually inspire me. Like I would love to, I don't know, maybe this is just, I would love to adopt those kids. So when I get home, I want to talk to my husband about that. This is 2 beautiful little girls. I just love them so much, and I want to adopt them. Bye. Thank you, America. Thank you, Haiti. Because those 2 kids just really touch my heart. All the kids touch my heart. It's just really like how we take things for granted. It really makes me think, wow, you know, these kids, they don't have the food they need, and they don't have the medical attention that they need.
She was 11 months old, and she looks adorable. She came with abdominal pain and rash. It's just her smile just caught my eyes. I have 2 daughters myself, so her smile, she just have that beautiful smile.
My experience to being part of the medical mission was awesome. I was working in the triage in Jacmel, taking blood pressure, heights. I did basically everything. It was a good experience, a good eye opener. It encouraged me to actually want to become a nurse so I could make a difference in these people's lives in Haiti.
One of the things that really touched me this year was looking at the children's face. I saw a lot of sadness, and I saw a lot of families who have lost individuals after the earthquake. They're suffering with post-traumatic symptoms, and we saw many people who suffered depression, and that really touched me, because the year before the children were much more happy, and obviously you see the earthquake after January 12th did actually affect their lives.
In memory of my brother, my goal is to start an organization that will mostly focus in the medical field of epilepsy, because there are many Haitians that are in Haiti, whether they be babies or teenagers to adults, that are epileptic, and many of them do not know or are aware of their issues. So my goal is to help them and to teach them of their disease, and also to find ways to help them and teach them ways of living to make it easier, as well as to give them the opportunity to have the medical treatment that a lot of people who are epileptic in the United States have.
This effort symbolizes HAPC's vision of collaboration amongst different Haitian associations. As a coalition, HAPC is pursuing a path of progress for Haitians everywhere. This mission at the École La Dignité is a great example of how a member of the association can achieve more for its cause by receiving the support of dozens of fellow corps members. HAPC is living the Haitian motto of l'union fait la force. HAPC is also supporting engineering, social, and economic development projects to its members, and recently sponsored a successful presidential forum in Miami. The coalition hopes that through its visibility, its infinite pool of dedicated Haitian talent, and a wide range of expertise, both the international community and the Haitian government will open up to the diaspora in their efforts to rebuild the country. Always striving to provide the best healthcare, the mission group reflected by night on how to best improve the next day. And after the mission was completed, some shared their wish list for all to reflect upon.
Each year when we do medical missions, whether it's in Haiti, whether it's in Dominican Republic, as I mentioned before, we do a debriefing session. Based on the debriefing sessions, we've collected data on how we can or suggestions on how we can do better next year. We already have a plan that's already devised by Suzanne Dennis and also Michael Dennis, who are two volunteers from the last mission, who actually devised a plan and how we can set up to make things more efficient, because our goal is to make sure we provide the best quality of care, not part of care, but the best quality for the patient, whether locally, whether abroad, whether in wherever we are. We want to make sure that the patients are treated with dignity, and so we will take those considerations and make sure we improve better. And I think if we can get a more collaborative effort, more physicians, more social workers and educators, and if we can get the entire core together as a coalition with 14 core member associations, we can do the best job possible to provide the best health care for Haitians in Haiti.
My goal and my hope would have been, like for Hannah especially, that if we try to go in one area, but to have something, I would say, where we can follow up. If we go every 3 months, then that every 3 months there will be a clinic that those people that you see, you can go back and follow up. But we go here and there, but there's actually no continuity. So that goes for some other group that does mission. So, you know, Haiti, all the night department people go from one department to another, from one city to another, but there is not actually no continuity of care. And then this is scary. So that's really my concern, and that's where I would love to see some improvement, is to that, even though if we start in one area.
To look at the condition of the children here in Haiti, especially at the earthquake, was a touching, emotional experience. But overall, if we help one person, that brought joy to me. And I believe we helped more than one person, and it was a marvelous experience. Being this is my first year, I would love to come back and continue the work with CAVCP and Hannah.
What I would ask for every individual, you don't only have to be a nurse, is volunteer, help out. You know,
we are an entity like, for example, the CAVCP. We do a lot of work down there. The people doesn't know about that, but at least we would like to know there will be some kind of funding, you know, for us also, so that we can use it properly to help people who need. I think also we might even need to have something like a dispensary. I don't say hospital. I don't say hospital, because I know hospital is a lot of money. But at least I always encourage the nurses, the doctors. So at least we have to have something down there, even a big dispensary. So when we live there, at least we have things piled there, so that when we leave, the patient can still have, you know, receive treatment. The doctor who come after us can still continue providing medical services. Okay, because when we go whatever we have, then after that we come back. So we don't leave anything behind. So if we leave medicine for 3 months, after 3 months there is nothing left. So the main point that I would like to have something like a dispensary.
What I would definitely improve, I would make sure I have more blood pressure medication, like the clonidine, that is able to lower the blood pressure right away. Because my concern was the blood pressure was so high, and I didn't want them to leave us, and even though we're giving them the medication before they leave, I didn't want them to leave us without taking the medication and have a stroke or heart attack.
If anything to improve the medical mission trip that we just experienced would be just to have more organization as far as the days, and to know the places and stations for everybody to work in, to make it a faster experience for the patients, because we were able to see over 500 patients, but that way if we have more organization, we will be able to see more. The most important change would be for more organization for the next mission trips.
The problem that we have, that because we have to transport all this medicine from here to Haiti, it's a lot of problem because of prices, the cost of transporting this medicine. If there were a way we could find those things in Haiti, that would be very helpful. Remember, Haiti, although they have pharmaceutical company, there's a lot of things that we need they cannot provide to us. So another way, we do need to spend a lot of money here in Miami to make sure that whatever we need to take care of these people, we have them at hand. It's very expensive, And whoever, we need people that are willing to donate to the association. So whatever they donate will go toward buying medicine that will serve those people in Haiti.
I learned a lot from this mission at first, because everybody, we live in America, we just take everything for granted. Now I learned that any little thing that I have to thank God because of it, because there's some people in Haiti, they don't even have what we have here, and we all complaining of every little things, So now I just like to, everything that I have, I like to thank God for it and respect everybody, and try to help anybody who needs help, because we're all the same. I hope that we have more people that volunteer to help, because there were like a lot of people that need help, and we were like a big group, but not that big, So I hope next year there's more people who's listening and who's watching us. They can come over, because I know there's a lot of people that can help us out. They can come and volunteer and help these people out.
From some of, and I will say a lot of them, they will not have a doctor for years. They will not see them. They cannot even pay the fare to go to the other city where they can maybe find a doctor. And I say find because sometimes we don't have doctor except if we go to Jacmel. And the mission is very, very important. It's at least 1 year they can have a checkup. They can have a response for their real problem. And they will have medication for their problems. So it's very, very important. I would love to have them more often, but it's a lot of work. It's a lot of work for us, and it's a lot of work for the organization itself that made it possible. And I will not dare ask them to do it twice a year because I know that they already have other things work in their hands. So it's very, very, and I said it's the only sense for not some of the people, but a lot of them to see a doctor.
But the one thing that backed up all the time was the pharmacy. I mean, and that's expected because you have to have the doctors and the nurses explain to the patients exactly what to do with the prescriptions so they know. And the little thing about there is like, maybe we can get some more clinical pharmacists to take care of that, to help out. And then we need to reinforce that with them because most of the people will forget what they need to do with the medicine, like the dosage or how often they need to take it.
What I would like to see happen is to continue with it. And but the more pressing is to see whether we can have something on a permanent basis where we can have a center where probably 3 or 4 nurses can come or a doctor every 3 months, a rotation, and to visit. Because keep in mind, these people come every year in September. They provide medicine, they provide they see the patients. But what happens next? Nothing happens until the following year. My goal is to see whether we can put a center here with a staff and to accommodate the town.
Well, when it comes to that experience, it's extremely rewarding. I mean, you have to give back. And if I have to change anything, we would have to get some more volunteers, some more nurses, more doctors, so we could have some more supplies such as blood pressure cuff, diabetic supply, more medication as well.
To volunteer, it's something that has to be within you. And giving back doesn't ask for much. You just have to be willing to give back. And when other people look at you working hard and they're willing to give a hand, that's probably they will. I'm not they will follow you as a leader. I said, if you can do it, I can. If this person can do it, I can do it too. You actually, they actually see you working. They're willing to come in and help you. This is the way I see it. I've been volunteer since I was in grade school. It's not something that I have done because I am a nurse. It's something that I can tell you it's a calling. Since grade school, I've been helping other people to learn how to read and write. Since I know how to read and write, people that worked in my community. So when I came here, it was easy for me to start getting involved in this community because having happy people around you make you happy. when I go to Haiti, I feel that I could have been those people that I'm serving. And you and I, we are like, if our parents didn't work hard for us to be here, we could have been those people. And if I was those people that lives in Haiti with no hope, with nothing, because there is no access to healthcare in Haiti, I would love for someone like them to come and help me. To have a complete life, giving back to Haiti, I think it's one of the main things that we all have to think about. Because when we look at ourselves who live here and compare to those to Haiti, we are just one step on those people's shoes, just one step. The only difference is we are luckier than them.
So in essence, I'd like to thank the sponsors who actually supported the initiative, such as CAVCP, Combit for Haiti, Miami-Dade College, and of course we've had other partners who always are at the forefront in making sure that the missions that we do are successful.
As with any voluntary mission, all of those who traveled to Haiti either had a personal connection or were fulfilling a need to give back in the most unselfish way. Many participants found more than that. Some found an urge to wanting to adopt a child or two. Others gave their own money, supplies to perfect strangers, while others related to individuals as potential relatives. The volunteer even wept at the story of an elderly woman, while others, grieving the loss of a child, felt the need to help bring this medical relief mission to hundreds in his memory. All these participants, however, were all bound by one thing: the love of a child.